So genetic hair loss or male pattern hair loss also comes in a form that we call diffuse patterned and unpatterned hair loss. The acronyms for that are DPA and DUPA. And let me explain briefly what these are. Diffuse patterned hair loss, or DPA, is a type of male pattern hair loss where instead of having recession at the temples and in the crown, you have kind of even thinning across the top of the scalp. And this is just a variant of, typical common baldness. In this case, the back and the sides of the scalp are permanent, and these patients are very good candidates for medical therapy and also good candidates for a hair transplant because the back and sides are stable. In diffuse unpatterned hair loss, or DUPA, which is actually less common, fortunately less common, patients not only thin on the top of the scalp, but they also thin on the back and sides. Now, DUPA is relatively uncommon in men. Perhaps 5% of male patients have DUPA, where DUPA is the most common form of hair loss in women. And that explains why women are not always good candidates for hair transplant, because since this hair thins all over, it thins on the back and sides, there's no permanent hair to use. So let's go back a second for men with DUPA. The way you make a diagnosis of DUPA in men is that you look for miniaturization or changes in hair diameter. And that change in hair diameter is not only seen at the top of the scalp where you're balding, but also on the back and sides where you expect the areas to be permanent. Diffuse unpatterned hair loss is sometimes very difficult to detect when someone is younger because these changes don't become apparent until sometimes late in the 20s. And that's a reason not to transplant someone too early. If you transplant someone that's going to have DUPA too early, the back and sides become thin, the scars may become visible, and that's whether you do FUE or FUT. And also, the transplanted hair will disappear because that donor area is not really permanent. The proper treatment for diffuse unpatterned hair loss is medical therapy, and both Rogaine and Propecia should be considered in these cases.